Sir, yes, sir. Thank you, sir. So, good evening and warm welcome, dear all. Today we are conducting, IFPH is conducting its 2091st day of uninterrupted daily webinar series. And before starting, 1 minute silent prayer. So, I am welcoming you all to the platform. So, today our guest is Professor Dr. Pratibha Singh, MD Homeo PhD. HOD and Assistant Professor, Department of Organon of Medicine, State LBSH Medical College and Hospital, Prayagraj. She has published many articles of mental diseases, thyroid disorders, PCOD, etc. Has conducted many medical camps and public awareness classes for public. She has presented various seminars nationally and internationally, more than 13 years of clinical experiences. And our topic today is mind-body connection in homeopathy, psychosomatic disorders and holistic healing. We warmly welcome dear Dr. Pratibha Singh to this wonderful platform. So now you can start. The dice is yours, ma'am. Please.
Yes, our guest has not joined. She's about to join. So we can wait for some minutes.
Okay, sir.
Yes. It's a big subject to be discussed today. That is mind-body connection in homeopathy. We used to say that homeopaths are practicing. Yes, doctor has joined. Yes, yes, I'm making you co-host, madam. Already,
Yes, ma'am. Ma'am, already I have given the introduction about you. So thank you so much, ma'am. Warm welcome. So now you can begin. The dice is yours, ma'am. Please.
Thank you, ma'am, for the visible introduction. And now we can come in for a topic. Just wait. I'm something late, actually. Okay. I'm sharing the screen and PPT. Am I audible?
yes.
Am I audible?
Yes, yes,
I'm
you're
audible.
audible.
Yes.
Okay. Thank you. Okay. Good evening, everyone. My topic is mind-body connection in homeopathy, psychosomatic disorders, and holistic healing. Now we can start. First of all, introduction. Yes. We can discuss about mind-body connection in homeopathy. Now, understanding psychosomatic disorders and their impact on health. What is the psychosomatic disorders? And what is the impact on our health? Next, homeopathic philosophy, vital force, and what mind-body unity. Homeopathic philosophy, whatever the homeopathic philosophy we can discuss, and vital force and mind-body unity. Next is clinical applications with case-based examples or the remedies. Holistic healing approaches and integration with modern science. Now we can start. Now the importance in modern health care. The stress-related illnesses rising worldwide. Nowadays, the stress is mostly everywhere or in every human being. Stress-related illnesses rising worldwide. So the modern lifestyle factors is main factor in this condition, like work pressure, isolation, digital overloads, and other emotional factors are driving a surge in stress-linked diseases. Next is conditions like migraine, hypertension, IBS, insomnia, and PCOS, rightly, are increasingly common across all age groups. The second point is conventional medicine often offers only symptomatic relief. Whichever the conventional medicines, whatever the medicines the doctors, the physicians gave to the patient or the persons, they gives only symptomatic relief. So conventional treatments usually target immediate physical symptoms without addressing underlying emotional or psychosomatic causes. No emotional causes or psychosomatic causes are important in that conventional medicine. Next is homeopathy provides a holistic alternative. The third point is homeopathy provides holistic alternative. Whatever the homeopathy provides, just the whole thing is holistic alternative cure. Homeopathy treats the whole person by addressing both emotional, mental, or physical dimensions of illness. So the homeopathy, we can all know, we are homeopaths and all know the homeopathy treats the person, not the disease. It aims to correct imbalances, offering long-term healing rather than temporary symptom relief. Its aim is correct imbalances. Whatever the disturbance in the lifestyle or in the mental level, whatever the stress, whatever the overload emotions, whatever they are the causes. So the homeopathy is balance to that thing and offering a long-term healing that is called cure. So rather temporary symptom relief, homeopathy is not giving temporary relief. It cures the person, it cures the patient in a whole way. Next is what are psychosomatic diseases. Now we are discussing what are psychosomatic disorders. The psychosomatic disorders occur when psychological stress or emotional conflict manifest as physical illness. The psychological stress, the emotional conflict, the grief, the tension, stress, when the overload of the emotions, the conflict occurs there and the diseases start to developing from that condition. So the stress, psychological stress, whenever the psychological stress is high or increasing in a person, the emotional conflict manifests and the physical illnesses starts to occur. The examples like migraine, IBS, hypertension, asthma, eczema, PCOS or PCOD, and many other diseases. We can say autoimmune diseases also, which are caused by the psychosomatic disorders.
सर फिर मेरे लिए मुझे फोन करना पड़ेगा मरहम की तरह इनको भी.
Is there any problem?
पासवर्ड है ना और आईडी है
Disturbances.
मुझे पता ही नहीं है मैं फिर उससे.
Is there any problem?
दफ्तर फोन नहीं करना, मुझे ऐसे ही चाहिए.
Some voice is hearing, ma'am. I don't know from where it is coming.
Okay.
मुझे भी इधर से उखेड़ देना, मुझे पता है.
Please mute.
मैंने आपको बता दिया.
There is so much of disturbance actually.
मैं करने लगी.
Okay, we are connecting. Now continue the topic. So we are discussing about psychosomatic disorders. So the examples are migraine, IBS, irritable bowel syndrome, hypertension, asthma, eczema, PCOS, the autoimmune diseases like these are also like hypothyroidism and rheumatic arthritis, rheumatism. These all are the diseases, and these diseases are caused by the psychosomatic disorders, because the cause are psychological stress or the overload of the emotion or emotional conflict. Next is emotional roots of illness. What are the emotional roots of illness? Here we are discuss the fear, grief, anxiety. These all are disturbed our physiology. The negative emotions, whatever the negative emotions, like the fear, in any condition of fear, in any condition of grief, or any grief, like loss of loved ones, the grief, that the remedies, all we knows the remedy like ignatia or natramur and other also. So negative emotions, whatever the negative emotions, grief, anxiety also, that disturb our body's physiology, that disturb our body's natural balance, and also to the vital force or vital force. So when vital force are disturbed, or our body's natural balance is not properly balanced, or there is imbalance in body's physiology, the diseases occurs like hypertension, like anxiety, like PCOS or PCOD, like other diseases, the psychosomatic. So the disturbance is, if the disturbance is there in body's physiology, then the disturbance is on the mental level also, because when the mental level is disturbance, then the physiology disturbed, and from there the disease occur. So these are the negative emotions. Whatever the negative emotions, if there such negative emotions are there, the disease develops. Next is the chronic stress. If the chronic stress are there, like if any disease, if the maintaining cause are there, then there is no cure in that case, because the maintaining cause are always on there. So here the homeopathy, what is work, homeopathy's work is to avoid these conditions, and homeopathy's work is cure from these negative emotions, from these emotions. When these emotions avoid by the person, or the medicine work like this, then the disease cures. So chronic stress or long-term disease progression, if the chronic stress is there, the disease progression is there, and the progression of diseases from long-term, prolonged emotional stress, if there, can gradually manifest as chronic physical diseases like migraine, hypertension, digestive disorders, etc. etc. Next, homeopathic philosophy. Vital force governs health and balance. Everyone knows the philosophy of homeopathy, so we can not discuss in deep. Vital force governs health and balance. Health is governed by the vital force, which maintains harmony between mind and body. So the work of vital force is to maintain the balance between mind and body. Next, mental symptoms central to remedy symptom. In this, we can discuss like a disease arises when this balance is disturbed. When the balance is disturbed, the connection of mind and body is disturbed, often starting at the emotional or mental level. When the balance is disturbed, often from the emotional level or mental level, the disease arises. In homeopathy, mental and emotional symptoms often guide remedy choice more strongly than physical complaints. So, in homeopathy, mental symptoms are more important. Next, the patient's inner state. The inner state, what is the inner state? Like fear, grief, irritability from anything, grief of anything from the family or outside, or tension or stress of the job, of the family, of the lifestyle, tension for money, tension for future, fear of death, etc., whatever the inner state of the patient, it helps in identify the constitutional remedy that restores balance. Like the fear of death leads to the arsenic. So the constitutional remedy, if we give there the constitutional remedy, the balance is restored and the case is solved. The case is cured. Hahnemann emphasizes mind-body unity. Dr. Samuel Hahnemann taught that mental and physical health are inseparably linked. Dr. Hahnemann taught that the mental health and the physical health both are linked together. They are not divided. They are not separate from each other. They be together, live together in a person. So, and that is the right thing, because mind and body connection, balance or imbalance decide the disease progression or health condition. Next, he stressed that emotional disturbances often precede physical illness, making the mind central to diagnosis and remedy selection. He says, whatever the emotional disturbance, if there is any emotional disturbance, it precedes the physical illness. If any emotional disturbance in mental level, the disease appears in physical level and making the mind central to diagnosis. And these symptoms or these cause are related to diagnosis, make the diagnosis, and based on that we can select the right remedy and cure the case. Next, we can relate remedies and emotional state. Not so much of examples, only few examples are there. I can discuss. May I discuss? So, homeopathic remedies are closely matched to the patient's emotional profile as well as physical symptoms. There are many remedies in homeopathy which works on emotional level, on mental level, especially, but only a few examples are here. First is ignitia, which is which based on grief, suppressed or suppressed emotions. Its core feeling is grief or suppressed emotions. Next is Nakswamika, the irritable constitution, irritability high on its peak, stress, because mental work is more preferred. Next, pulsatilla, the emotional sensitivity. The emotional sensitivity, everything is emotions for pulsatilla. Sensitive, mild, weeping tendency, and also greedy. So the whatever the core feeling, mostly mental level, we can pick the rubrics especially related to mentals. Then for me, it is cure many cases. It was. So emotional sensitivity. Next is calcarea carb, which is based on fear and insecurity. The insecurity is high on the peak level. Everything, insecurity for everything. Insecure in every condition. The chili remedy, and we can relate. We are relating the calcarea carb or the Easter shell. Outer layer hard, inner layer, inner is soft. So calcarea carb main core theme is fear and insecurity. Arsenic album. Next is arsenic album and the anxiety of everything. Fear from everything, fear of death. So the remedy is related to the emotional state, and many other remedies also there, but here is few only. Next, clinical applications. Discussing clinical application here, stress related conditions like migraine, insomnia, IBS, hypertension, hypothyroidism, and etc. And the second point is constitutional remedies, restore balance. Now we are discussing homeopathy is applied in stress-related and psychosomatic disorders such as migraine, IBS, hypertension, and insomnia. Not in only such conditions, homeopathy is applied in every condition or every disease, but we are discussing about psychosomatic disorders. So I'm saying that homeopathy is applied when the homeopathy applied in stress-related psychosomatic disorders. The remedies are chosen by analyzing the patient's mental state, emotional triggers, and physical symptoms together. When we doing the case taking of a person, of a patient, we can ask the diseased symptom, whatever his diseased condition, whatever the symptoms of the patient, with the mental state, with triggers, emotional triggers like anger, which what level of anger is there, what level of weeping is there. Is weep ameliorates or aggravates? Is there any condition or any emotion which aggravates the condition or ameliorates the condition? And then other the physical symptoms also. So when we conclude in case taking, the mental state, the emotional triggers, the maintaining cause, the exciting cause, the cause, main cause, the physical symptoms. So all together we can pick and then make a picture, make a case of a patient and finalize the remedy. So mental state is very important. Emotional triggers are very important because they create the physical imbalance. The next is this integrative approach provides long-term healing, improved patient satisfaction, and complements modern medical care. So the long-term healing means here it is related to cure. So this integrative approach provides cure, improve patient satisfaction. If the patient is satisfied, you cured half of the case, half or not half, 70 to 80% cure your patient and complements modern medical science. Next is integration with modern science. We are talking about the modern science, the modern vocabulary, the psychoneuroimmunology. Here, what is the psychoneuroimmunology? It is weak immunity from stress. So psychoneuroimmunology relates how stress weakens immunity and influences disease progression. How the disease progress from weak immunity and how the immunity was weak. It weakened by the stress. So psychoneuroimmunology shows how stress weakens immunity and influences disease progression. Next is neuroscience. Stress alters brain chemistry. The stress, the strain, the tension, the grief, the emotions, everything, every negative emotion alters brain chemistry. And it creates the hormonal disturbance. When the hormonal disturbance is there, it appears in physical level and the symptoms appears. So neuroscience alters brain chemistry. Next is homeopathy complements these findings by treating both mental and physical aspects. Simultaneously, homeopathy complements all these findings because it treats the whole person, not the disease. It treats whole person, not the disease. So, whole person like mental, physical, and of course social, the the definition of health by WHO is the mental, physical, and social well-being. So homeopathy cures like this. It cures mentally, physically, and socially also. Next is holistic healing approaches. Here, holistic healing, when holistic healing approach, firstly, the remedies which the physician repertorize and finalize, plus the lifestyle changes. Healing goes with remedies and some other changes also there, like lifestyle changes, counseling, meditation, stress management. It promote the healing. It can give speedy healing, because some percent of the process of healing it covers also. So remedies plus lifestyle changes cures the whole case with easy term. Next, patient education for resilience. The patient education is very important, because if the patient educate about their own, about homeopathy, about lifestyle changes, about his disease, about its own, then he understand the connection of mind and body. Then whatever the physician said to patient, he will do that thing only. So patient education is very important for resilience. Patient education empowers individuals to understand the mind-body link. If they understand the mind-body link, they help you to treating them. Next is patient-centered care. Patient-centered care is first of all, listening to patient's story, whatever they said, whatever they told for his condition. You can listen, the patient's story listening is very important. Listen the whole story of the patient without interruptions and no prejudices. No interruptions in any case. If there is an interruption between the case or between the patient, whatever said to you, whatever told about them, then the flow is break, and the patient.
Doctor, the PPT is not available now.
PPT is not available.
Yes. Kindly share it.
Okay, just a sec, sir. Sharing भी कर रखा है. Is there available?
Yes. Now it is coming.
Something is
Yes, now it is visible. Now it is visible.
okay. Okay. Just a second.
The slides are not.
Pardon, sir?
The first slide itself is remaining there. Slides is not moving.
Okay.
Which slide you are taking?
There is some issue in
Yes.
network actually.
Oh, it may be the weak network. That may be the reason. The network may be weak. Oh, now it is coming. Okay, now it is way. Holistic
Okay.
health approaches is the which one you are talking about the case.
Yeah.
Then you can go.
Now is it okay, sir?
Now it is basic emotions,
Is it okay, sir?
and now it is basic emotions. You want to go to the case?
Okay, sir. Just a bit.
Global perspectives and future patient-centered care.
Your voice is not clear, sir.
Patient-centered care is there.
Okay. Yes, sir. Patient-centered care. Now we continue.
Yes. Global perspectives and future directions.
Okay, sir. Patient-centered care. I'm is here.
That's what we are discussing.
Yes, sir.
Yes.
Okay. So, listening to patient's story. Listen the whole story to the patient without interruptions and no prejudiceness. There will be no interruptions between the flow of the patient telling whatever they're telling about their disease or their symptoms. And there will be no prejudiceness also, because before repertorize any case, we can't go to any medicine for the only disease condition. Next is validating emotions, acknowledging and respecting the patient's feeling without judgment. Whatever the patient feel, if the patient tells you their feelings, their emotions, then respect for their feelings and try to acknowledging him without judgment, without any judgment. Next is help build trust. If the patient coming to you and any person coming to you, you have to help build trust, reduces emotional distress, and supports holistic healing. When we reduce emotional distress, the overload of emotions, if they reduce, then the holistic healing will be there. Next, tailoring treatment to individual needs. Homeopathy designs treatment based on the totality of symptoms. That means physical, emotional, and mental level. Physical symptoms, whatever the symptoms arrived after the disturbance on the emotions, like after grief, after fear, after any negative emotion, whatever the symptoms come, the physicals on the physical level, that physical symptoms and that emotional symptoms, the core feeling, the cause of the disease, and the mental, these all makes the totality of symptom. So homeopathy designs on this. Next is each patient receives a personalized remedy plan that reflects their unique constitution, lifestyle, and emotional profile. There is no remedy for any disease in homeopathy. There is remedy for constitution. When patient came to me, we have to see the constitution. We have to see the whatever the disease and what the mental state, what the emotional state, what is the constitution. So we have to see the constitution, the lifestyle, and emotional profile. The emotional profile, the lifestyle, all these join together and form a constitution. So we haven't any personalized remedy, only we have constitution, and on the basis of constitution, the final remedy is there. Next, global perspective and future directions. Homeopathy in integrative health. Homeopathy is gaining recognition worldwide as integrative and patient-centered healthcare models. If we can talk about the world, about the condition of the whole world, there is mainly there was so much of stress conditions, and on that basis, homeopathy works very well on that conditions. So here, homeopathy gained the recognition worldwide. Next, research collaborations in psychosomatic care. If there is any research for psychosomatic diseases in homeopathy, collaborate to the other, and future directions include evidence-based research, because there is, if the research is there, then what is the evidence? So evidence-based research, digital health integration, cross-disciplinary collaborations, psychology, public health. These all are research there. Next, expanding global acceptance. Emphasis is on global advocacy, education, and support to strengthen its role in modern health care system. If we expand the global acceptance of homeopathy, then it should be there have the global advocacy also. The education of homeopathy is also the support also. These all strength give strength to the homeopathy in modern healthcare system. Key takeaways पे आ जाते हैं. Oh, sorry. Now we come on to key takeaways. Homeopathy treats the whole person. First of all, homeopathy treats the whole person, not only disease, not only symptom. It treats the whole person. It cures the person in whole. Next, integrates classical philosophy plus Integrates classical philosophy plus modern science. The classical philosophy of homeopathy with the modern science. Homeopathy unites Hahnemann's vital force philosophy. What is the philosophy of vital force of Hahnemann's? That with insights from modern neuroscience and stress research bridging tradition and science. Homeopathy unites Hahnemann's vital force philosophy. The vital force philosophy with modern neuroscience. The imbalance by the stress, and it creates the imbalance in brain chemistry and stress research. These all bridging tradition and science. The next is offers a credible holistic healing model. Homeopathy offers a credible holistic healing to the world. Now we come on the summary of discussion. First of all, stress-related illnesses rising worldwide. The modern lifestyle pressures drive psychosomatic disorders. The autoimmune diseases, the grief, emotions that that cause the diseases. Next, conventional medicine often provides only symptomatic relief, and homeopathy provides cure to the person, to the whole. Homeopathy offers holistic alternative treating root causes and mind-body unity. Homeopathy works on root cause and mind-body unity. It treats the cause and cure the patient. Next, importance in modern health care. Addresses rising stress disorders with integrative healing. Psychosomatic disorders, we discussed before that emotional stress manifests as physical illness. Whatever the emotional stress, whatever the emotional emotions, grief, anger, sadness, it causes the physical illnesses, the migraine, IBS, hypertension, hypothyroidism, rheumatism, rheumatic arthritis, psoriasis, eczema, and PCOS, and many other diseases. Next, emotional roots of illness. The roots of illness are there. We can discuss above: the fear, grief, anxiety, disturbed balance of mind and body, leading to chronic disease. Next is homeopathic philosophy. Vital force governs health, like cures like principle. Everyone knows homeopathic philosophy because all homeopaths are here. That the principle is similia similibus curenter. Like cures like. Next, mental symptoms in remedy selection. Emotional state guides remedy choice more than physical signs. physical science are not are physical science are important, but the more important is emotional state, mental state, because the cause is there. The cause is inside the emotion, inside the mental state. And when we remove the cause, the disease removes. So, emotional state guides remedy choice more than physical science. Hahnemann's emphasis. Mind-body unity is central to diagnosis and treatment. Mind-body unity relates to the diagnose the disease, and on the basis of diagnosis, can provide the treatment. So the main thing is the unity of mind and body. Remedies and emotional states. Remedies matched to emotions. Ignitia for grief. Nux vomica for irritability. Arsenic for anxiety. And many other remedies are there, which works on emotional state mainly. So when remedies match to the emotions, the constitutional comes in front of us, and we can provide the medicine according to the constitution. Next, clinical applications. Effective in stress-related and psychosomatic conditions. Clinical applications are effective mainly in stress-related conditions, which are psychosomatic conditions. Integrative health system. Homeopathy complements modern medicine also for holistic care, because holistic care is in homeopathy only. Global perspective and future directions. Growing recognition, evidence-based research, and digital integration. Here we can grow from the digital media also in worldwide. The evidence-based research, how the other people who don't know about the homeopathy, how they believe on homeopathy when they see the evidence, when they see the researches, when they know about that researches, when they know about the about these homeopathy. And this is from these things also, or from digital media, through media also. Next, integration of classical plus and modern. Bridges Hahnemann's philosophy with neuroscience and stress science.
Yes, ma'am.
Now, this is the topic and discussion about this. Thank you, sir. And thank you all.
Yes, ma'am. Thank you so much, ma'am. It's a wonderful section regarding psychosomatic disorders and homeopathy. So those who want to ask any questions, you can ask because only 6 minutes more. Please.
Yes, Dr. Pratibha Singh, it's a very good session. Unfortunately, the screen sharing was not perfect in the beginning, and as a result, we lost some of the big points you point out because you were simply explaining those things in the PPT, so we couldn't read it,
Yes, sir.
and that was a big miss. Anyway, it was as you point out, homeopathy is entirely a different system, and we will have to look into the mind more than anything else. And if you
Yes.
study the mind in a better way, you will be able to choose the right medicine accordingly. And that's what
Yes, sir.
got from the presentation. And individualization is also very important. And one point you point out here was that do not interrupt the patient while he is telling the symptoms. That's a very important point. If
Yes.
you are not, sometimes we or the bystanders may direct the patient in some other way, so that patient may miss the big point that he or she supposed to share with us, and we were unable to find the right remedy in that way. Sometimes we may lose the case. So it is very important to not to interrupt the patient while he is speaking or she is telling her symptom. And sometimes
Yes.
patient want to talk in a private manner. Sometimes he or she want to avoid the bystander. So it is the duty of the physician to give such a position for the patient to talk freely. And that is also very important.
Yes, sir.
Otherwise, we may lead to a remedy and not the right medicine. And that one,
Yes, sir.
we may lose the case also. So what we need is we need to encourage more people to study the mind of the patient rather than the anatomy, physiology, pathology. Then nowadays, the syllabus is giving more stress to anatomy, physiology, pathology, practice of medicine, all these things, except material medica and organo. So it's a high time to take note of these things, and it is the duty of the people sitting at the educational system to change the syllabus in such a way so that the people will be able to understand how to study
So
medicine.
these all subject are related to each other,
Yes, yes.
and these subject helps to find the remedy also.
Okay, our Vice President, Dr. Shaji Kudiatis, want to talk to you.
Yes.
Thank you, Dr. Danesh, and thank you, Dr. Pratibha Singh. I also wish to enlighten on this occasion about what is happening around the world. As Dr. Pratibha Singh mentioned, the mind plays a crucial role, and our thoughts are energy vibrations that influence our vital force. But unfortunately, what is happening today is our mind is educated and filled with unnatural and unhealthy concepts and attitudes by those forces who control the world. They're corrupting our mind. And that corruption is one of the important causes that we need to be aware about and need to brought to the awareness of the fellow human beings so that we can consciously and make a concerted effort to defend ourselves to remain healthy is an important point today.
Yes, sir. Yes, sir. This is very important.
So that is an important point. Prevention is better than cure. Just by
Cure.
keeping our mind in the naturally positive, constructive way, we can prevent many diseases. As time is getting
Yes,
closer, I
only
am
1
winding.
minute more,
Thank
sir.
you. Thank you.
Yes.
Sir, Ram Parvesh, sir, please, as vote of thanks to Dr. Singh.
Thank
Pratibha
you.
Singh, please.
Thank you, Sheila. And Namaskar, everyone. And Namaskar, Dr.
Namaste, sir.
Sajid Korea, Vice President. And congratulations, Dr. Pratibha Singh. Mind
Thank you, sir.
and mind-body connection and vital force.
Thank you, sir. Thank you so much, sir.
Main cause of disease, mind, or sign and symptom, physical. So mind is an important psychosomatic disorder or physical disease aggravation. है ना? Anger,
Yes, sir.
anxiety, functional anger, anxiety, grief, stress.
Sir, time is over, sir, please.
एक हिंदी में कहावत है कि काम बात कफ लोभ अपारा क्रोध पित्त छाती। एंगर होने से जो है गैस का फॉर्मेशन होता है और अधिक कामू व्यक्ति को बात का रिजल्ट होता है।
Okay, sir. Please say.
लोभी व्यक्ति को सर एक मिनट, लोभी व्यक्ति को जो है कफ लोभ अपारा कफ का फॉर्मेशन है। तो यह माइंड बॉडी कनेक्शन है। तो वेरी वेरी थैंक्स डॉक्टर प्रतिभा सिंह,
Thank you, sir.
Thank you. Thank you.
IFPH whole team. Very very thanks. Thank you. घर घर
Thank you,
होम्योपैथी, घर घर होम्योपैथी।
Thank you, sir. Thank you so much, sir.
Yeah, thank you, ma'am. Thank you so much. It's already over. Time is over. So handed over to
Yeah,
the
yeah.
program session. Please,
Tomorrow we will
Dr.
have a
Manoj.
session. Tomorrow we will have a session from Dr. Shilly Sharma. Counseling. Okay.
Okay, thank you, sir.
Over to Dr. Manoj.